If you are experiencing foundation issues, get a free estimate from Ox Foundations.
Daybreak Live continues. We're joined by Glenn Sisk, CEO of Coosa Valley Medical Center. And Glenn, good morning to you, sir.
Good morning.
Good to have you with us this morning. And man, March seemed like forever ago, doesn't it? And when did you first begin to hear about this COVID-19?
Well, obviously, you look back at the fall when we were thinking flu season was beginning to be somewhat rampant, as it is every year, with the turn of the calendar into January and February. And then March came, and what we were hearing about across the world began to hit a little closer to home. And we sort of went to mid-March, around the 15th or so, when we began to see our world in healthcare and really our lives personally begin to change pretty dramatically.
Now, we were okay until about July or so.
Yeah, you know, it's really been an interesting study. When you think about what's happened across the state, Talladega County in March and April was really doing fantastic. The percentages were very, very low. When we look back at the testing that we've done at CVMC, both in the hospital and in our clinics, we were running 6 to 8% on the positive rate. And then we moved fast forward into July, and all of a sudden our rate has jumped up in the 25, 26, 27% positive rate. So it really has changed pretty dramatically.
How many ICU units do we have?
We have one intensive care unit, 10 beds. We're very well equipped with a tremendous staff. I will say this, and appropriate for me to recognize them this morning. They've been working extremely hard over the last month or so.
It's amazing.
It's amazing how courageous, compassionate they've been to face this risk head on and continue to be there day in and day out, and really want to recognize them along with our medical staff for their good work in the ICU.
Where are we now at CVMC as far as COVID-19?
Well, as we think about the overall pandemic, we've tested now 681 patients altogether. We have had 125 patients that have tested positive for an overall 18% positive rate. Today in the hospital, we have 6 patients that are admitted that are positive, and we have another 9 that have been tested that are pending at this point.
So do you see this thing kind of slowing? I know we're seem to be peaking here in Sylacauga at CVMC.
Well, you know, interestingly, you take UAB, for example. Earlier this week, they released some information that their trends are going down in terms of the inpatient numbers. Actually, it appears that our trends are going just the opposite direction. And we're prepared to provide care, very well prepared to provide care for all the patients who come to CVMC that have symptoms associated with COVID. However, when we think about Memorial Day, 2 to 3 weeks after, we began to see a little bit of a spike. And we think about July the 4th, 2 to 3 weeks following that holiday, and we saw a spike. Now Labor Day is coming. Schools are beginning to move back in. Sports activities are ramping up. So there is concern that we need to continue to be very, very cautious. We've heard ad nauseum social distancing, wash your hands, wear your mask, and we want to encourage people to continue to do that.
Almost 1,100 Talladega County residents tested positive for COVID-18 in the last 24 hours or so. And CVMC not only is right here in Sylacauga, but you get a lot of people from other areas of our county too.
Well, we do, and really when you think about our geographic footprint, we touch really 5 counties that we think about in terms of primary and secondary service area. Russell Medical Center in Alex City, Citizens Baptist, Brookwood, and Talladega all have worked very hard, just as CVMC has. I know the Birmingham hospitals have done the same. Obviously, at some point in time, there was concern about ventilator management and would we have enough vents to provide care. Thankfully, that has continued to be the case. We work very closely with the Alabama Hospital Association, the Department of Public Health, to ensure not only that staffing is in place, PPE is in place, ventilators and the management of those continues to be very good. So we're very well prepared for it. And one thing I would say that I would like for your listeners to fully understand is the hospital is a safe place. We have never in the history of our organization worked harder to ensure that the hospital is clean, that the care that's delivered is delivered in a very safe and effective environment. not only daily, but hourly. Our staff is working very hard, our environmental services team, our clinical team, to ensure that it's a safe place for care. So we really want to encourage people not to delay care. We're hearing stories about people having chest pain and sitting at home for days on end because of fear to come to the hospital. Please do not do that. We want to encourage people to come to the hospital as they need to.
No doubt about it. Glenn Sisk, CEO at Coosa Valley Medical Center in Sylacauga, our guest for a few more moments today. When, Glenn, did you begin to say, hey, this is an all hands on deck event?
Well, I think early on we really ramped up, and as you pointed out very effectively early, we ramped up for not a lot happening. And we've not gotten lackadaisical throughout the process. We've continued to be prepared. However, over the last 30 to 35 days or so, we've really seen some pretty significant challenges with the positive rate, as I mentioned, in the 25+% range. So our team continues to do a fantastic job to meet people at their point of need, and they're doing that just this morning. And that certainly reminds us that there are guidelines and protocols at Coosa Valley Medical Center that we must adhere to as far as people coming in to the hospital. That's exactly right. At this point in time, we're continuing to follow the Department of Public Health guidelines as it relates to visitors. We do allow one visitor to come into the hospital with patients for inpatient and outpatient activity, excepting in the ICU and on 3 West, where we've been able to quarantine the COVID patients. And we understand that to be a challenge. We recognize that when you have a friend, a family member, a loved one that's in the hospital, you want to be there with them, and we want to be sympathetic to that, but at the same time, we want to focus primarily on their care, getting them well, and hopefully back home very soon. You mentioned 4th of July. We've got Labor Day just ahead, and that's another giant challenge because, you know, even though we're masking and doing some things better, we just love getting together in Alabama. We do. We like to eat some barbecue and maybe watch some football, right? Hopefully. Hopefully that will be the case. But what I know people are frustrated by the masks. I will admit to the very same thing, but they work. They're very effective. Keep hand cleaner close by. Keep your mask on. Obviously, we have our mask this morning, but we social distance. And hopefully we'll begin to see this thing moving in the right direction sooner rather than later. Coosa Valley Medical Center's Glenn Sisk with us this morning on Daybreak Live. Walk us through where we are. Now, you talked about numbers of people who have tested positive or are being treated for COVID-19. How much flexibility do we have now at our local hospital? Flexibility as far as being able to care for COVID-19 patients? Well, as I mentioned a moment ago, we're very fortunate that our materials management team has done a fantastic job in terms of providing access to PPE for us. And I would be remiss if I didn't take a moment to thank and recognize people in the community. We've had examples of people showing up, bringing food to our staff continuously. We've had examples of local churches building and preparing things for us to help prepare for the care of COVID patients. And we certainly would continue to accept those kind and generous offers as we continue to battle through this. From a staffing standpoint, we are challenged at times, just as every hospital in the country and across the world has been. But we've continued to be amazed at how people on a day off have said, you know what, rather than spending today with my family, there are people at Coosa Valley Medical Center who need my help, my support, my expertise, my compassion, and they come in on days off to work, and those things have continued to make a tremendous difference. So can't say enough good things about our staff. We're very well prepared to meet people at their point of need. I will admit to you, we want this to begin to normalize. And frankly, as we look forward into the fall, there is concern about flu season coming and the impact that COVID would have associated with that. So let's continue to practice good, safe health habits. The emergency room, Glenn, is just that. It's an emergency room, and you talk about
saluting a group of individuals, a team that has gone far and above the call of duty. That's one of them.
That is a great point, and thank you for bringing that up. We really saw in April our volume in the emergency department when the stay-at-home order began go down pretty dramatically. Our average daily census in the emergency department is about 75. In the April months, we were some days in the 20s and 30s in terms of visits. We have begun to see that volume come back, fortunately, which means people hopefully are not delaying care any longer. But our team of emergency room physicians, our team of nurses and support team in the emergency department, again, have been very brave and courageous and continue to do amazing work.
We lost a giant in our community, Ron Johnson, just a few weeks ago, and what an ally he was for Coosa Valley Medical Center.
He certainly was. He was a very good friend, not only to Coosa Valley Medical Center, but when you think about the activities of healthcare in Montgomery, Alabama, there was nobody, I dare say, in the House of Representatives over the last 20 or 25 years who had more of an impact on healthcare. We'll miss him for a long time.
No doubt about it. Glenn Sisk, CEO of Coosa Valley Medical Center, our guest this morning. I appreciate you coming today. And just before we go, once again, mention what we need to be doing right now as citizens in our community to stay safe.
Well, I've always believed throughout, as we began to understand what this looked like, that we needed to open our economy, that local businesses needed to have the opportunity to continue to thrive and do well, area restaurants and that sort of thing. However, we need to recognize the responsibilities that they have to social distance, to at times tell us at the door there are too many people in the shop or in the place of business. Please keep your masks close by, hand cleaner close by, wash your hands often, clean surfaces that are used very often, and we'll get through this together.
All right, Glenn Sisk, our guest this morning. Glenn, always a pleasure, sir.
Thank you.
More Daybreak right after this.